Hello everyone, and welcome to today's webinar, Publishing Open Access in Cambridge Journals. My name is Catherine Hill, and I'm an executive publisher at Cambridge University Press, based in our UK office. Before we get started, I'd like to go over a few items so you know how to participate in today's event. This webinar is being recorded, and you'll receive a link to the recording in a follow-up email. You have all joined in listen-only mode. However, you will have the opportunity to submit text questions by typing your questions into the Q&A pane on the control panel. Please feel free to send in your questions at any time during the presentation, and we'll collect these and address them during the Q&A session at the end of today. Should you experience any technical difficulties, please add this to the chat box, and a member of the organising team will endeavour to help you. And in the unlikely event that we experience any major technical issues, we'll message and restart the webinar. Presentation should be about 30 minutes long, and then we'll answer any questions that you've submitted. And at the end of the webinar, there'll be a short survey where you can raise any further questions or provide us with any feedback. So moving on to the panel. Before we get started properly, I'd like to take this opportunity to introduce the rest of the panel to you. So today we have 4 panelists. As I've already mentioned, I'm Catherine. I'm the executive publisher in our Cambridge office, and I look after our applied life and health science journals. My colleague Anne Avoris is also executive publisher based in our New York office. Anne has over 15 years of experience in the publishing industry and is responsible for growing and developing both social sciences and STM titles. Our guest speaker today is Professor Sally Kendall, Professor of Community Nursing and Public Health at the University of Kent, and co-editor-in-chief of Primary Healthcare Research and Development, which is an internationally recognised journal that flipped to fully open access under Sally's stewardship. And finally, my colleague John Edwards, our Open Research Sales Manager based in the New York office, will join the Q&A panel to help answer questions about publishing agreements. Next slide, please. So the session today will cover the basics of open access. We'll take a bit of time to highlight key benefits and present some evidence of the increased impact of choosing this option. Sally will share her perspectives on the opportunities open access affords and the changing landscape around it, before Anne goes on to explain some of the options for publishing open access at Cambridge, including how to benefit from publishing agreements with your institution. Before we begin, we'd like to take a short poll to see how many of you have had experience publishing open access. So hopefully shortly you should see a poll come up on your screen, and please select the most appropriate option for you, and then I'll share the results with you shortly. Yep, I can see it now, so hopefully it's there for you all too. Okay, interesting. So 57% of you have never published open access before. So hopefully after today, you'll know a little bit more about open access, the options of doing that, and what some of the benefits of publishing open access will be. So moving on to discuss open access in a little bit more detail. The 2 main open access types that you'll hear about are gold and green. Both gold and green open access mean that articles published under these models are free to access. With gold, this is immediate access on publication, whereas with green, there's often an embargo period. Almost every journal offers reuse under green open access guidelines, and this should be made clear on the journal or publisher website. Whereas with gold, this is typically determined by the type of user license the author selects. And I'll go on to talk in a little bit more detail about the different licenses in later slides. With gold open access, an article processing charge, or APC, is usually required, and this is either paid by the author or sometimes on their behalf by their institution or funding body, whereas with green open access, there is no fee. With gold open access, there are 2 ways you can publish, usually either by publishing in a hybrid journal or in a fully open access journal, and I'll describe what these 2 different types of journal look like on the next slide. For green open access, you should check your journal guidelines for publishing instructions, but usually authors publish in the journal and then self-archive a version of their paper in a repository. Open access is often confused with free access. So subscription articles may be granted free access as part of a marketing campaign, for example, and made freely available for a month or 2 months. Although both open access and free access allow access to the research, with free access, there is typically no reuse, modifying, or sharing allowed. And also free access is usually only available for a specified period of time. So it's quite different from open access. Okay, next slide, please. So this slide just details the different types of open access journals that we typically see. The first one is Diamond Open Access. So these are usually funded by a society or funder. So there is no author payment required, but the content is still freely available. A fully gold open access journal. So with these, authors are usually required to pay an APC either individually or via their funder or institution, and the content is freely available to all. A hybrid journal, so this was something I mentioned on the previous slide. This is made up of a mixture of subscription and open access content, with only the open access articles having an APC. The OA content in a hybrid journal is available for everyone to read, but the subscription content is usually behind a paywall, so people need to subscribe to read. And then finally, a non-OA or a subscription journal, and these journals have no APCs charged to publish, but the content is behind a paywall, so people need to pay a subscription to read the content. Importantly, you'll notice that each of these journals listed has the peer-reviewed content column ticked. So regardless of the journal model, peer review is an integral part of each of them. The standard and quality of peer review should not vary regardless of open access status of the journal. The next slide, please. And this slide is just really to demonstrate the growth of gold open access, and the data has come from the Dimensions database and shows the growth in gold open access content in recent years, with over 1.6 million gold open access articles published in 2020. Next slide, please. There are many key drivers behind open access, some from an author perspective I'll go on to talk about in more detail shortly. However, these drivers also include negotiations with institutions and library consortia, as well as funder policies. There are many funders actively engaging in this discussion around open access, and this slide just gives examples of some of those, including UKRI, the World Health Organization, Bill and Melinda Gates Foundation, and many more worldwide. Aside from funder requirements, as mentioned previously, next slide, please. There are a number of other benefits of publishing open access. OA content is freely available online, not hidden behind a paywall, which leads to increased discoverability and the potential for higher citations for your work. On average, studies have shown that OA articles are downloaded 3 times more than non-OA articles on average and receive 30 to 50% more citations. We also believe open access is beneficial for the academic community as a whole, breaking down barriers of access and ensuring that anyone, wherever they are based in the world, can read and benefit from research. So I'm now going to go on to very briefly present some data based on our own journals, with the aim of answering the following question: do authors really gain an advantage by publishing gold open access? By way of context, gold OA publication has for some years now been steadily increasing as a proportion of our publishing at Cambridge. It's moved from 14% of our article publishing in 2019 to 22% in 2020, and is set to increase substantially again in 2021. The usage data for these articles is unequivocal in showing that gold OA articles on average receive substantially more usage on our own platform. The chart you're looking at now summarizes PDF and full text HTML views received within the first 12 months after publication by the 18,000 research articles we published in 2019. The dotted lines that you can see show the average downloads for the non-OA research articles, and this compares against the solid lines, which show the same measurement for the OA articles. Whether you look at the mean or the median, across the list as a whole, open access articles have been getting roughly 3 times more usage on average than their non-OA counterparts. And this effect is immediate, visible in the first month after publication and persisting through to month 12. Moving on to look at citations. So looking at the same 2019 dataset, we also have some limited evidence emerging around citation patterns. We only have a 2-year citation window to look at for these articles, but this box plot here shows that open access articles are trending towards higher levels of citation in both STM and HSS disciplines. There's nothing conclusive about this yet, but the early evidence seems positive. And moving on to non-academic citations. So looking at the same 2019 data set, we can see from this slide that we have some evidence to show from our altmetrics data that open access articles received on average 61% more social media mentions. They were 185% more likely to be referenced in a news article or a media blog, and they were 52% more likely to be mentioned in a policy paper. So all of this evidence comes together to corroborate from our own programme what we're indeed seeing in the external research. There does appear to be an open access advantage. It applies across disciplines in humanities and social sciences as much as in scientific, technical and medicine disciplines. The gains, especially in respect to usage, are not marginal, but substantial in scale and prolonged over time. And there is evidence too that this increased usage is translating into material gains to scholarship, more citation, more debate, discussion, more policy impact, and more public impact or reaching broader audiences. So moving on from the benefits of open access publishing in general, and next slide please. One of the common misconceptions we hear with regard to open access is that researchers are worried they're giving up all of their copyrights. Open access articles in our fully Gold OA and hybrid journals are published under Creative Commons or CC licenses, meaning that you retain the original copyright to your work. These licenses govern reuse, which is a key point of the open access movement. I'm not going to go into detail of all these licenses here, as that would be a whole separate presentation on its own, but there are some of the most common variations listed on this slide, and please do visit the website listed here for more information. And finally, it's really important to check your funder or institutional requirements, as they may mandate a specific type of license that you need to sign. Finally, just looking at what researchers say. I'm not going to read out these quotes to you, but these are just a few quotes from researchers publishing in our journals as to why they've chosen open access. It's clear that many of them have made this choice to ensure that the research is accessible to a wide and different variety of stakeholders, including policymakers, researchers in the Global South, and those without institutional affiliation. Hopefully I've given you a brief overview there of the different types of open access available, as well as some of the many reasons that our authors are choosing this option. I'm now going to hand over to Sally to talk about her perspectives as an editor-in-chief.
Thank you. Thank you, Catherine, and good afternoon or good evening to everybody who's joined. So I'm going to just present a few slides about how open access has affected our journal, Primary Healthcare Research and Development. And I'm presenting this on behalf of myself as one of the co-editors-in-chief and Professor Ros Breyer, who is my partner on this journal. And to just inform you that Primary Healthcare Research and Development is the official journal of the European Forum for Primary Healthcare. So Primary Healthcare Research and Development is a fully open access, gold open access journal, and it is aimed at both researchers, academics, and practitioners in primary healthcare, which is really important in terms of the open access side of things, because we want practitioners to be able to read the evidence and the research findings from studies in primary healthcare. And it's also an international and an interdisciplinary journal, which means we have a very broad spectrum of readers and authors who we would like to have as much access as possible to the papers. We have a very special interest around how health services can be integrated and how different healthcare systems work across the landscape, around intersectionality and transitions in healthcare. And again, this means we're working with a very broad range of researchers, policymakers, managers, and practitioners, all of whom we want to be able to access our papers. So we welcome papers from all of those disciplines. The journal became fully open access, gold open access in 2018. And whilst we saw this as being very advantageous to the journal and to our international readership and research community, I must say, to start with, we were a little bit concerned about how the authors in our field would find the funds to cover their APC charges. And this was very much related to this breadth of authorship and readership that I've referred to, because they are in very many parts of the world that have, poor access to research funding and poor access to academic libraries. So we were concerned about that initially. But what we've seen is a gradual increase in submissions, which have been very good for the journal. And we've seen a number of waivers introduced for the APCs and concessions put in place by Cambridge University Press. So that has certainly enabled the whole process of becoming gold open access to be advantageous to the journal and to our authors. And now that we're involved in the institutional agreements across the world, this has provided a huge opportunity for researchers with access through their institution to gold open access to the APC charges being covered. That has made, we think, a great difference to our authorship. Next slide, please. So what is the value of open access publishing? To just add to Catherine's comments from an editor's perspective, well, first of all, it does ensure that research from many institutions globally can offer open access to authors without them having to negotiate a lot of bureaucracy within the institution or with their funders. So this institutional agreement has provided a really easy and fantastic opportunity for authors to simply click and find out if their institution is part of the agreement. And I think there'll be a few more words said about that later, but it's really very easy to do. Of course, it brings promotional opportunities to the authors and to the institutions that are undertaking the research in primary care. So as soon as that paper is gold open access, it can be promoted through social media and through websites and so on, which is a huge advantage to authors and institutions. It makes publishing so much easier for early career researchers who may not have access to research funds or funds for APCs through smaller grants. So this has been seen as another real value. And it means that important research within the journal is accessible to all of those who need it to develop implementation plans and improvement. So for policy, practice and commissioning and management of services, there is a much greater access to the evidence. And of course, it increases the opportunity for the journal to benefit from citation and improvement of our impact factor. Next slide, please. So we currently have an impact factor of 1.11 in 2019. We're obviously, as any journal, trying to improve and develop. But I think from the graph here, which relates to citations over the period since we became, just before and since we became open access, you can see that both on the total annual citations to all content, there's been a steep rise in citations over that period. And if you look just at the content that was published in the previous 2 years, you can also see that there is quite a steep rise since 2018 in the number of citations. So whilst this can't be sort of made absolutely concrete, I think in line with what Catherine has said, we are seeing a very important and encouraging trend in citation rates since going gold open access. Thank you. Next slide. So overall, we see this as editors as a win-win situation for both the journal, for authors, for institutions, and for publishers. So we can see that there is the opportunity for a much wider and public readership. So this is research that can be made available not just to academics, but to the wider public. That primary care practitioners and policymakers have access to evidence, as well as researchers and authors being able to both publish widely and openly, often without charge. And importantly, our EFPC members, the European Forum for Primary Care members, have access to this process also. Research funders are interested in either providing the cost of the APC, but are importantly very interested in the way that we're then able to disseminate the research findings, which is critically important to any kind of funding, as you will all be well aware. Institutions themselves can benefit through the dissemination of the research and the impact of the research on policy and practice. And finally, the publishers and the journal itself will considerably benefit from the citation rate as it increases. So this is genuinely, I think, a way where we started a little bit concerned about how it would impact on authors. We are now really convinced of the value of the gold open access system and the way that the journal can work in partnership with its publishers at Cambridge. So any questions that you have, please put them in the Q&A and I'll be happy to pick them up at the end. Thank you.
Thank you, Sally. I am now going to give you an overview of what Cambridge University Press is doing in response to these conditions. First, we're focusing on open access models that deliver author equity. Back in 2018, most of our open access was from a small and relatively privileged subset of authors with major grant funding that could pay APCs. Now, 51% of our open access publishing is through read and publish agreements, which include scholars at every career level in institutions of different sizes and types, and in many different countries. We are pursuing gold open access, not green, as you can see in the slide. We don't see green as a long-term solution to author and reader access of academic material. Gold open access prioritizes the journal version of record, as Catherine mentioned earlier. We're also making it simpler for authors to choose open access. We know it's very difficult for authors to navigate this new world. Too many options, too many conflicting messages, not enough clarity about eligibility for different types of open access. So we're investing heavily in making that infrastructure as simple as possible for you. We have 49 fully gold or diamond open access journals at the press, along with 324 hybrid journals, which allow open access article publishing on an individual article basis. There are very few journals on our list now that do not allow open access publishing in some form. We are also encouraging our hybrid journals to apply for what is called transformative journal status as a route to compliance with Plan S, and now have over 200 journals with such status. These journals have all committed to the goal of transitioning to fully gold open access by gradually increasing their open access content in line with growth targets set by Coalition S. We will continue to reduce the subscription prices for these and other journals through our double dipping policy as the amount of non-open access content falls. As noted, we aim to be a majority open access publisher by 2025, in line with our and our parent university's mission to thoroughly disseminate research worldwide. Next slide, please. Because of the steps we have taken to encourage and develop open access publishing within our list, Gold Open Access publication as a proportion of our overall output has for some years now been steadily increasing, as Catherine mentioned earlier. Open access article publishing comprised 22% of our overall publishing in 2020, but is set to increase substantially again in 2021 with the advent of our new read and publish deals, over 1,000 worldwide and over 100 in the US alone, as you'll see in later slides. The end of 2020 in particular saw rapid growth in our open access output across a number of subject disciplines, not just in the sciences where you'd expect the strongest take-up. Next slide, please. We'll be doing another poll now to gauge everyone's awareness of the existence of read and publish deals at your institutions. So I'll pause now to give everyone a chance to answer and see the results. Actually very happy with that response, that 46% of you are already aware. For those that are not sure, I would encourage everyone to go to the links that will be shared at the end of this presentation and use the eligibility checker tool, which I'll talk about in a moment. This slide represents just a small selection of our fully gold open access journals, which, as you can see, span a number of subject areas in the health and human sciences, microbiology, agriculture, environmental science, economics, even history. As the understanding of open access grows in various communities and funding pathways can be transferred from the so-called author pays APC model to the library pays read and publish model, new disciplines can enjoy the significant benefits that open access can bring to their publications. Some of the journals on this slide were launched gold open access at their beginnings, for example, Global Mental Health, and some were converted from a subscription model when it became clear that there was enough community, library, and or funder support to make the change. For example, Oryx, which flipped only this year. Next slide, please. As I mentioned earlier, publishing open access typically incurs an article processing charge. This charge is usually paid by the author's funding body or institution. In a survey, 74% of respondents thought that the availability of an APC waiver or discount was either somewhat or very important in their decision to publish open access. Of those who had not published open access, the most cited reason was not having budget available to pay the APC. That was 48% of respondents. It's important to note that under a read and publish agreement, full waivers or APC discounts are available to both gold open access and hybrid journals. As I mentioned, we now have agreements covering over 1,000 institutions worldwide, most of which offer a full waiver of publication costs. If you are not based at an institution that has already signed a read and publish agreement with us, we also have waivers and discounts available in our fully gold open access journals. Authors from low and middle income countries, based on the Research for Life country list, will have APC costs fully waived for Group A countries or reduced by 50% for Group B countries. These journals also offer full discretionary waivers so that anyone without access to funding can still publish in the journal. Waivers and discounts do not apply to our hybrid journals, as any author unable to pay the APC can publish a subscription article in the usual way and make it available as green open access after the allowed period of time, 6 months in the humanities and social sciences and 12 in the sciences. Our ultimate goal is to ensure that no one is prevented from publishing in our journals, no matter the publication model. Next slide, please. This map shows the breadth of our read and publish coverage worldwide, with agreements now in over 35 countries. We negotiate with institutions large and small, from national agreements to small liberal arts colleges, from governmental entities to community colleges. Most recently, we have signed over 100 agreements within the United States, as well as negotiating a national deal with the GIST consortium in the UK, to which institutions can opt in. We see read and publish as a sustainable way to bring open access accessibility to all researchers, regardless of area of study or geographical location, and we are constantly updating our public-facing map to show where our newest deals are located. Next slide, please. To check your eligibility for a waiver or discount under Research for Life or Read and Publish, you can use our eligibility checker tool found online. This details the discount available, link to the specifics of any agreement, and the journals covered by the agreement. We'll share links to these pages in the follow-up email with a session recording. It is important to note that to be eligible for a Read and Publish discount or waiver, the corresponding author must be based at a Read and Publish institution. Only the affiliation of the corresponding author will determine eligibility. As a reminder, the corresponding author is the person who handles the manuscript and correspondence during the publication process, has the authority to act on behalf of all co-authors in all matters pertaining to publication, and who acts as the point of contact for any inquiries after the paper is published. When considering the choice of corresponding author, you will now also want to consider Read and Publish eligibility, not just when publishing with Cambridge, but with other publishers as well. Next slide, please. Publishing in a fully gold open access journal, that is a journal that is entirely open access without exception, is extremely straightforward. When publishing open access within a hybrid journal, the author does have a choice to make. The process is much the same as subscription publishing. All articles still go through the same peer review process and are accepted or rejected by the same editor. The key point for deciding on open access publication in Cambridge hybrid journals is upon acceptance. After acceptance, you will be asked to complete an author publishing agreement, also known here as a license to publish form, and select to publish open access under a Creative Commons license. Next slide, please. Once you have decided to publish open access in any of our journals, the APC transaction process is then triggered. APC transactions are coordinated by our third-party service provider, RightsLink. If we have a Read and Publish agreement with your institution, your APC will either be automatically waived, or you may need to choose seek a waiver from your institution when prompted by RightsLink. This depends on how your institution's agreement is set up. You can find out more by using the waiver and discount tool or reviewing your deals agreement on Cambridge Core. If you are not covered by an RNP agreement, you will go ahead and pay your APC. You can also apply any discounts for which you may be eligible in the affiliation section. A guide is available to help you through this, again, in the links that we will circulate after the webinar. Next slide, please. After your article is published, we strongly suggest you participate in your own author marketing of your publication. As you have seen, open access allows for further usage and potentially citation of your work than does publication under a subscription model, but this does not happen automatically. Sharing your article on social media, adding appropriate citations to Wikipedia, recording a quick video, or posting a blog about your article are all great ways to ensure it reaches the broadest possible audience. Our Author Hub has a number of guides to help you navigate the world of post-publication article promotion, and links are shared with authors every time an article is published, and again will be shared after this presentation as well. We will now move into a Q&A session with all of our presenters, as well as my colleague John Edwards, who is joining us from Library Sales, and Neil Patrick from our marketing team, who will be moderating.
Great, thank you, Anne. Thanks for that. And thanks for joining everyone today. I hope everyone found it useful. As we said a couple of times, the slides and recording of the session will be sent out in the next week. Any questions that we don't manage to get to that have been posed today, we will put some answers together in the form of a Q&A document. We'll send that out as well. So don't worry if your question isn't answered in this session now. We will provide an answer at some point, and you'll get that in the email. We've also got some URLs that we're going to include in the follow-up email. They're going to send you to a few pages on Cambridge Core website. More information on open access, some open access myths that we dispel, information on how to publish with Cambridge, why you should do that. So keep your eye out for those as well. We've also had a couple of questions about certification that came in before the session. We don't provide a certificate, but an email, you'll get an email confirmation of your attendance here, and that will serve similar purpose as a certification. Okay, so let's start with the questions. The first one that came in was regarding plagiarism, was what about plagiarism problems? So I'm going to send this to our editorial team, and I'll give you a break, and I'll send it to Catherine if that's okay.
Yeah, that's fine. Thanks, Neil. So plagiarism problems are not any more likely for an open access journal or a subscription journal. Many of our journals use tools such as Authenticate to look for plagiarism when articles are submitted. So that means when an article is submitted to our journals, they would be run through a plagiarism software called Authenticate, which would flag up the amount of content that had been plagiarized or had been kind of taken from another similar article. We don't see that there's any more, this is any more likely for an open access article over a subscription article though. So again, it's something that our journals are quite familiar with and will continue to use.
Thanks, Catherine. We've got another question here just regarding the data that Catherine presented early on. I think this was in regards to the data around citations for, we saw the graphs with the data citations rising and the downloads rising. And whether we had those for specific maths journals. I think we will have that somewhere, so we'll try and get that included in the email that we send afterwards.
Yeah, I was just going to add that, Neil. Yeah, we definitely do have some of this data broken down by different subject areas. So yeah, happy to provide that more information.
Perfect. Thanks, Catherine. We've got a question here. There's a link to a website which is actually operated by Cambridge University, so it's outside our control, but it refers to the APC charge that publishers charge. It's got Cambridge listed on there. It's slightly incorrect. So I'll just take this one and then I'll pass it on to anyone else if they want to have a quick discussion about it. The APC that we currently charge at Cambridge is £2,045, which is around $3,000. So the link that I think it's Kevin put in the chat is out of date. I don't know whether Anne or John or Catherine wanted to add anything to that.
Just to say that I was on that link last week and noticed the same thing, that it is very much out of date, not just for us, but for other publishers as well.
Okay. Well, I'll be sure to get in touch with them. Okay, let's have a look. So there's a question here which we kind of covered, but it might be worth saying a bit more. John, I'll put this one to you. This is a concern about the cost to institutions, whether the institutions are paying for a subscription to a journal as well as the fee to support the author of APC. This was kind of covered in our read and publish section, but if you wanted to give a bit more detail around that, just to explain it a bit further.
Yeah, definitely. Thanks, Neil. Hi, everybody. I think what's really important for us to say is that the model Cambridge uses for read and publish is specifically designed to repurpose subscription spend on open access publishing. So our model doesn't place those two costs on top of each other. What we do is we look at the money that you're spending with us on a subscription basis, and we enable you to repurpose that entirely onto open access publishing. So you're not paying for two things at once, as we're in this process of moving from the old subscription model over to the new world, whatever that might look like in a few years' time. We're running a kind of hybrid provision for institutions. So that's really important, because I think we're really conscious of managing the cost and controlling the cost and making this change in a sustainable way. So we don't place those two costs on top of each other for institutions. I hope that's helpful.
Thanks, John. Just while you're there as well, there's another read and publish question just regarding plans for an RMP agreement in Canada. I just wonder whether you could just speak to that quickly.
Yeah, we're in the process of discussions with CRKN. So we are in the process of drafting a proposal for them, which we were invited to do, and we will be continuing to talk to them through the remainder of this year with an eye on hopefully beginning an agreement at the beginning of 2022. More to come on that front.
Great, thanks so much. We've had a couple of questions around people worried about getting funding and paying for these APCs, especially ones in developing countries that don't have scholarships, that don't have discounts. And maybe you could just speak quickly to this sort of process of discretionary waivers, research for life, etc.
Yes, absolutely. First, I just want to emphasize that for the Gold Open Access journals that we publish, We have a discretionary waiver policy in place for each of those. And what that means is that an author prior to submission is asked to provide evidence that they do not have funding. Usually this is just in the form of a letter from the head of their department. And if you provide that evidence, we will waive the full APC and you can proceed with your submission. So that is in place with every Gold Open Access journal that we publish. So there should not be a barrier in place if you do not have access to funding for publication in those journals. For researchers that are based in Group A or Group B countries as defined by Research for Life, and I hope we can share a link to the Research for Life list in the communication that goes out after this presentation. That process is automatic, so you do not need to apply. If you are in Group A, you will automatically receive a 100% waiver. If you are in a Group B country, and remember again, this is the corresponding author that has to be based in one of these countries. If you are in a Group B country, you will automatically receive a 50% waiver. If you need to apply for a full 100% waiver, you would simply go through the discretionary waiver process that I just described. So there should not be any reason why you cannot publish for free in one of our Gold Open Access journals if you do not have funding. If you are trying to publish in a hybrid journal and you do not have funding for open access, we are expecting that you will publish under the subscription model. Although in the medium term, we are looking into options to support author equity in publishing open access within subscription models as well.
Great, thanks, Anne. We've had a couple of questions on publication time. So I'm not sure whether people are worried that maybe open access takes longer or is quicker than non-open access. So Catherine, maybe you could just have a few words on that.
Yeah, absolutely. In terms of publication time, I really can't comment on the amount of time it takes for individual journals because it's so dependent on the journal and the community. But there should be no reason why open access journals would take longer, certainly. As I mentioned at the start, they go through exactly the same peer review process. So the processes are the same. They'll be assigned to an editor that will go out to reviewers. And the time taken for peer review is really dependent on the editorial team in place. But we're endeavouring at the moment to reduce our turnaround times as far as possible across our whole journal portfolio. So open access should have no impact in terms of the time to publication.
Great, thanks, Catherine. Sally, there's a question here which hopefully you can address as well. As an editor-in-chief, how can a journal move from the hybrid format to entirely open access? So maybe you could just talk briefly around the process that you went through at the beginning, how you decided, when you decided to flip PHC from non-open access to open access. Are you on mute, Sally?
Yeah, thanks very much for the question. I think that, to be very honest with you, primary healthcare was in a slightly different position to maybe a hybrid journal that's making that consideration today. As I say, we flipped in 2018 from a hybrid to Gold Open Access. And that decision was, for us, very much made in close communication and discussion with Cambridge. I think we had worked very hard to improve our citation rate over a period of time, and it was felt that at that point we were ready to become Gold Open Access as our citation rate and our submission rate was improving, and a number of other metrics around turnaround and so on. We, as part of that decision, were very considerate of both what that would mean for the authors, but also what it meant in terms of, the purpose of Gold Open Access in terms of dissemination and access to science for the rest of the world. So we had to make a careful and balanced decision. And we were guided by Cambridge. And as I said in my presentation, we were a little bit nervous at the beginning because of the kind of authorship that we attract, which a very wide breadth of authors from not just from academia, but from clinical practice. We were a bit anxious about how authors would find the APCs without any access to funding. But as time has gone on, it's been proved to us, and we feel confident now that, as Anne has described, there should be nobody who is in a position where they cannot afford the APCs and therefore can't publish. And we are now reassured about that, and very confident that the decision we made on the basis of how would this balance out for authors and for our community, our readership, our networks, I think we made the right decision. And I would encourage other editors to really think about it as a way of really ensuring that these papers are genuinely accessible to whoever needs them, really.
Great, thanks, Sally, thanks for that. There's a question here, I think Anne touched on this during the presentation about a corresponding author. So someone's got a question, they're planning to publish an article with a colleague from a different university. I know I have to be the corresponding author, but should I also be the first in the author's order? And is that something that, I think that was what you covered, or was that Catherine? I can't remember now, sorry.
I did cover it. No, it is just as long as they're indicated as corresponding. That's the only qualification. Okay,
brilliant. There's another question here. Is it possible for an author to change his or her license to publish for some time afterwards? If, as in, for example, if he or she was not aware that open access APC will be covered by an institution. John, I think, do you want to take that one, or anyone? Feel free.
Yes, we do permit changes. There are a number of different ways that can happen. One thing I'll say, and I'll hand it off to Anne or Catherine after to add the editorial perspective, but if an author doesn't select to publish open access under an agreement the first time around, if you like, the first opportunity they have to do so, we have a process whereby we reach out to authors and extend this opportunity a second time through a very basic process of adding an addendum to the publishing agreement that they have signed already. And we do that within about a month of the article publishing online in one of our journals. So it's really important that we maximize the possibility of an author taking up that opportunity when it exists. Anne or Catherine, do you want to add anything else on that front?
Yeah, basically what you said. I will just emphasize this is an opportunity. The author is not required to take it up, although we certainly hope that people will do, and I assume that the attendees of this webinar are very interested in open access, and if given the opportunity to update their license in their article, they would take advantage of that. This is also something that we can include in the distribution after the webinar, the contact email address to get in touch if you would like to retroactively make your article open access, if you found out that it should have been covered under an agreement, or you now have funds to pay an APC and would like to make that article open access.
Great, thanks both. There's a question here regarding hybrid journals. Are there separate impact factors for each type of publication, i.e. OA versus non-OA? Catherine, I'll send that one your way, I think.
Sorry, are there separate impact factors for each type? So no. So the impact factor calculation does not discriminate on open access or hybrid journals. The impact factors would be calculated in exactly the same way. Obviously, as you saw from the kind of analysis I shared earlier, it seems that sort of early evidence suggests that there is a higher level of citations for open access journals, and therefore typically we would expect a journal that's converted from hybrid to open access after some period of time, the impact factor to grow, as we're hopefully seeing with PHC. But no, there's no difference between a gold open access or a hybrid impact factor. There's one calculation.
Great, thanks a lot. John, one more for you here. Does CUP allow institutions to pick and choose which journals to cover in a publishing agreement? This person's an editor at the Journal of British Studies, and they're concerned about this, which might hurt the humanities disciplines.
Yeah, great question. because we've got a very clear ambition to provide open futures for all of the journals that we publish, and that's across all disciplines, so across the humanities, social sciences, and STEM subjects. And because of that ambition, the way we intend to support all those journals is by asking institutions to support the full list that we publish through read and publish agreements. So we ask that institutions participate in a collection of journals. So that might be the STM collection, it might be the HSS collection, or more often than not, it's the full journals collection. And that's really important to us. It doesn't always go down well with librarians who are very keen to retain an element of choice and control in the journals that they choose to support. But for us, we have a very, very clear ambition, and that's designed to safeguard in a large part the humanities subjects that we publish for and on behalf of. So we don't allow a pick and choose model for people participating in read and publish, no.
Great, thanks, John. There's a question here which I'll just answer quickly, whether there's an open access option for CUP books and monographs. There is, we do publish open access books. This is a discussion that you probably have with your editor. It's a slightly different process, but it's, again, a very straightforward one, unless Catherine or Anne or John want to say anything about that. I'll add some more information to the post-webinar email, but just to say that, yes, there is. Okay, next question then. There's also a request about a step-by-step guide available on the workflow for authors. We do have that. That is on the website. Again, that will be covered in the links that we send out after the presentation as well. Okay, so I've got time for a few more. So under read and publish deals, does the author get to choose the form of CC license they would like to use? Would anyone like to take that one? Anna.
Yes. The answer is yes. We've actually just added 2 more license options. So I think we have a total of 6 now available for authors to choose. Inclusion in a read and publish deal has no bearing on licenses. What might impact that is your funders' requirements.
Brilliant. This is one, just to go back to what you're saying, John, about the sort of retroactive OA. Can an author affiliated with an institution that is now party to a read and publish deal ask for OA in relation to publications that came out before the read and publish agreement? So say things published 10 years ago.
No, unfortunately they can't. So the parameters to qualify for retroactive open access is that the article must have been published within the term of the agreement that we have with the institution. So if that's true, then you would be able to take advantage of that retroactive process. But unfortunately, if the article is published prior to that, then it wouldn't be eligible.
Great, thanks a lot. Quick one here. How do we verify the corresponding author's institution? Anne or Catherine, would you like to take that one?
And Anne may want to add to this, but in terms of verifying the institution, I guess it would just be via the email. So we would send out an email to the corresponding author and their email address would be affiliated to that institution. I don't know if there's anything else that we do, John or Anne, to verify corresponding authors.
No, and sometimes people do have multiple affiliations, of course. I don't think that's something that we do. We assume that authors are representing themselves honestly in their articles. And there's, even with RNP, that wouldn't be enough of an incentive to provide a false affiliation.
Great, thank you. Question here about with a read and publish or gold OA article, can the author agree to posting of the version of record anywhere, or is it only through links from Cambridge Core?
I can take that. Yes, yeah, you can post it anywhere. We do recommend, however, that even with Gold Open Access articles, you use a course share link and link back to the article on our website rather than posting your version of record elsewhere. It's fully within your rights to do so, but maintaining all the usage on the Cambridge platform allows us to continue to give you full and accurate information on the article's usage. And that's, you know, obviously useful not just for the author, but for readers as well.
Great, thanks, Anne. There's a question here about Plan S and transformative journals. John, I think this was mentioned during the presentation, but could you just, this is obviously really only relevant to European institutions, but if you could just speak very briefly on the sort of process and the push that Plan S have given for this in the last few years.
Yeah, sure. I mean, on the transformative journals front, we've signed up, I think, in the region of about 280, 275 of our journals to the Transformative Journals program, which is very important because it offers an additional route to Plan S compliance for authors publishing within those titles. It also means that we are committed to flipping those journals to a gold OA model when the percentage of content within that journal reaches, I think it's 75%. So that's a great thing for us to have done, I think. It's fantastic to have that public intention to move such a large chunk of our journals in that direction. And I think, yeah, it's a great opportunity for us. And on Plan S more broadly, I think we're expecting the sort of the format that Plan S eventually takes to potentially keep changing slightly. I think we've seen that it's a very iterative thing in itself, and we're continuing to engage very closely with the funders and with everybody at Coalition S in which shape that should ultimately take. Yeah.
Thanks, John. We're running out of time now, so I'm going to hand back over to Catherine, who's just going to wrap everything up. So thanks everyone for your time on those questions.
Great, thanks Neil. So firstly, thanks so much to all the panellists today, so all of my colleagues and especially our guest panellist, Professor Sally Kendall. And thanks to all of you for joining us and for asking so many great questions as well and keeping this conversation going. I hope that if we were to ask you those same questions that we asked earlier on in a year's time, there would be a higher percentage of you who've been able to take up the open access publishing option, and also that all of you are clear about whether your institutions have an OA publishing agreement in place. So do go on to look at that eligibility checker and to check whether your institution is covered. There'll be a short survey at the end of this webinar, so should you wish to submit any more questions and also provide us with any feedback. And as we've already said, we'll be sharing the recording with attendees after the webinar, and we'll also include some of the links that have been mentioned in this slide deck and lots of the links that, again, we've talked about in this Q&A. So just finally, huge thanks for joining us today, and I hope it's been useful. Many thanks.